Family planning and contraception. Family planning refers to the practice of individuals and couples making informed decisions about when to have children, how many children to have, and the spacing between children. Contraception, on the other hand, refers to the use of methods, devices, or drugs to prevent pregnancy. Contraception is an essential component of family planning as it allows individuals and couples to have control over their fertility and make informed decisions about their reproductive health. Contraceptive methods include condoms, oral contraceptives, the pill, intrauterine devices IUDs, implants, patches, injections, and sterilization. Family planning and contraception are important for several reasons. 1. Health. Family planning and contraception can help prevent unintended pregnancies, which can lead to complications such as unsafe abortions, maternal morbidity and mortality, and infant mortality. 2. Economic well-being. Family planning and contraception can help individuals and families plan their lives and make informed decisions about education, careers, and financial stability. 3. Environmental sustainability. Family planning and contraception can help reduce population growth and promote sustainable development. 4. Gender equality. Family planning and contraception can help promote gender equality by empowering women to make informed decisions about their reproductive health and reducing gender-based violence and discrimination. Overall, family planning and contraception are essential components of reproductive and sexual health that contribute to individual and public health, well-being, and sustainable development. Natural methods of birth control. A calendar method, rhythm method. The calendar method, also known as the rhythm method, is a natural method of birth control in which an individual or couple tracks the menstrual cycle to determine the fertile and infertile days for sexual intercourse. The method involves identifying the fertile period of the menstrual cycle, which is the time when the ovary releases an egg that can be fertilized by sperm. To use the calendar method, an individual or couple must track the menstrual cycle for several months to determine the average length of the cycle. They must also identify the fertile period, which is typically about 5 to 7 days before ovulation and 1 to 2 days after ovulation. During the fertile period, the couple can avoid sexual intercourse, use a barrier method of contraception such as a condom, or use other natural methods of contraception, such as withdrawal or cervical mucus monitoring. The calendar method is a natural and inexpensive method of contraception, but it is not as effective as some other methods. The method requires careful tracking of the menstrual cycle, and even then, there is a risk of unintended pregnancy. The effectiveness also depends on the regularity of the menstrual cycle and other factors that can affect ovulation, such as stress and illness. B. Coitus interruptus. Coitus interruptus, also known as the withdrawal method or pulling out, is a natural method of birth control in which the male partner withdraws his penis before ejaculation to prevent sperm from entering the vagina and fertilizing an egg. The withdrawal method is simple and free, but it is not very effective at preventing pregnancy. It can be difficult for the male partner to withdraw in time, and there is a risk of pre-ejaculate containing sperm. Additionally, this method does not protect against sexually transmitted infections (STIs). The withdrawal method may be used in combination with other natural methods of contraception or with barrier methods, such as condoms, for greater effectiveness. However, it is generally not recommended as a primary method of birth control. Barrier methods of birth control. The condom sheath. The condom, also known as the sheath, is a barrier method of birth control that is worn over the penis during sexual intercourse to prevent sperm from entering the vagina and fertilizing an egg. Condoms can be made from latex, polyurethane, or natural materials like sheepskin. They come in different sizes, shapes, and textures to suit individual preferences. Condoms are effective at preventing pregnancy and also provide protection against sexually transmitted infections (STIs), including HIV. However, they must be used correctly and consistently to be effective. A condom should be put on before any genital contact and must be used for the entire duration of sexual activity. It is important to check the expiration date and make sure the condom is not damaged before use. Condoms are widely available and can be purchased over the counter at drugstores, supermarkets, or online retailers. They are relatively inexpensive and do not require a prescription. Condoms can also be used in combination with other methods of birth control for greater effectiveness. B. The diaphragm. The diaphragm is a barrier method of birth control consisting of a flexible rubber or silicone dome-shaped device that is inserted into the vagina to cover the cervix and prevent sperm from entering the uterus and fertilizing an egg. The diaphragm must be fitted by a healthcare provider to ensure the correct size and fit for the individual. It is usually used in combination with spermicide, a chemical that kills sperm, to increase effectiveness. The diaphragm is effective at preventing pregnancy when used correctly and consistently, but it requires careful placement and must be left in place for at least 6 hours after intercourse. It is important to check the diaphragm for holes or tears before each use and to replace it every 2 years or if the individual gains or loses more than 15 pounds. The diaphragm is a reversible and non-hormonal method of birth control and does not affect natural hormones or menstruation. It provides no protection against sexually transmitted infections (STIs), so it may be used in combination with condoms for greater protection. The diaphragm requires a prescription and can be purchased at a healthcare provider's office or pharmacy. Chemical method of birth control. Chemical methods of birth control involve the use of hormones to prevent ovulation and/or thicken cervical mucus to block sperm from entering the uterus. There are several types of chemical methods of birth control, including 1. Birth control pills, also known as oral contraceptives. Birth control pills are a daily hormonal pill taken to prevent ovulation. There are different types of birth control pills, including combination pills that contain both estrogen and progestin-only pills. 2. Birth control patch. This is a transdermal patch that contains hormones and is applied to the skin once a week to prevent pregnancy. 3. Birth control ring, also known as a vaginal ring. This is a small, flexible ring that is inserted into the vagina once a month to release hormones and prevent ovulation. 4. Birth control injection. This is a hormonal injection that is given every few months to prevent ovulation. 5. Birth control implant. This is a small, flexible rod that is inserted under the skin of the arm and releases hormones to prevent ovulation for up to 3 years. Chemical methods of birth control are highly effective at preventing pregnancy when used correctly and consistently. They may also have health benefits, such as reducing the risk of certain types of cancer and improving menstrual symptoms. However, they may also have side effects, and some may not be suitable for certain individuals. Chemical methods of birth control require a prescription and should be discussed with a healthcare provider. Intrauterine devices, IUD. Intrauterine devices IUDs are a form of long-acting reversible contraception that are inserted into the uterus by a healthcare provider. There are 2 types of IUDs available in the United States: copper IUDs and hormonal IUDs. Copper IUDs are non-hormonal and work by releasing copper into the uterus, which makes it toxic to sperm and prevents fertilization. Hormonal IUDs release progestin, a synthetic hormone that thickens cervical mucus and prevents ovulation. Both types of IUDs are highly effective at preventing pregnancy, with a failure rate of less than 1%. IUDs can be used for several years and are reversible, meaning that fertility returns quickly after removal. IUDs are inserted by a healthcare provider during an office visit and can be removed at any time. The procedure can cause cramping and spotting, but most people tolerate it well. Some people may experience side effects, such as irregular bleeding, headaches, or acne. There is also a small risk of infection or perforation during insertion. IUDs are a safe and convenient form of birth control that do not require daily attention or interruption of sex. They do not protect against sexually transmitted infections (STIs), so they may be used in combination with condoms or other STI prevention methods for greater protection. IUDs require a prescription and may be covered by insurance. Sterilization. A. Male sterilization vasectomy. B. Female sterilization. Tubal ligation. Sterilization refers to surgical procedures that permanently prevent an individual from being able to conceive or reproduce. A. Male sterilization, also known as vasectomy, is a procedure that involves cutting or blocking the vas deferens tubes that carry sperm from the testicles to the urethra. This prevents sperm from being ejaculated during sexual activity, therefore making the individual unable to fertilize a female egg. B. Female sterilization, also known as tubal ligation or getting your tubes tied, involves cutting or blocking the fallopian tubes that connect the ovaries to the uterus. This prevents eggs from being able to travel to the uterus, therefore making the individual unable to conceive. Social cultural practices which enhance family planning. There are several social and cultural practices that can enhance family planning. 1. Education. Educating people, especially women, about the benefits of family planning can increase their awareness and understanding of family planning methods, leading to an increased use of contraceptives. 2. Community-based distribution. Community-based distribution of contraceptives can increase access to family planning services, particularly in underserved communities. 3. Religious and community leaders. Engaging religious and community leaders can help to dispel myths and misconceptions about family planning and promote the use of contraceptives. 4. Mass media. The use of mass media, such as television, radio, and billboards, can be an effective way of disseminating information about family planning. 5. Peer education. Peer education, where individuals learn about family planning from their peers, can help to reduce social stigma and increase acceptance of family planning methods. 6. Partner involvement. Involvement of partners in family planning decision-making can help to increase contraceptive use and improve communication between partners. 7. Healthcare worker training. Training healthcare workers to provide non-judgmental and confidential family planning services can help to increase the uptake of family planning services. Importance of male involvement in family planning. Male involvement in family planning is important for several reasons. 1. Shared responsibility. Family planning is not only a women's issue. Men have a shared responsibility in family planning, and their involvement can lead to more effective and sustainable family planning efforts. 2. Improved communication. Involving men in family planning can enhance communication between partners, leading to better decision-making, understanding and support for family planning. 3. Better health outcomes. Male involvement in family planning can lead to improved reproductive health outcomes, such as reducing maternal mortality rates, preventing sexually transmitted infections, and promoting healthy timing and spacing of pregnancies. 4. Increased use of contraceptives. Men who are involved in family planning are more likely to use contraceptives, and also encourage their partners to use them consistently and effectively. 5. Improved gender equality. By involving men in family planning decision-making, it helps to promote gender equality, respect for women's reproductive rights, and greater spousal communication and involvement in family matters. 6. Positive impact on children. Involved and supportive fathers can also have a positive impact on children's health, education and overall well-being. Revision exercise. 1. Why is family planning important? 2. What are the effects of unplanned family? 3. What is the role of the male in family planning? 4. How is sex education helpful in family planning? Revision exercise. 1. Why is family planning important? 2. What are the effects of unplanned family? 3. What is the role of the male in family planning? 4. How is sex education helpful in family planning?